I want to give you a quick real-life example of muscle activation techniques in action. Patient comes in with back pain, and I watch the patient, say, bend forward, and they're very stiff, or they have pain with bending forward. So what I already know then, or is a possibility, is this, is that the muscles on the front of the body, the core muscles, are not functioning properly. And so let's say there are 10 muscles that are required to engage properly and activate properly in order for this patient to be able to bend forward with no problems, and it's easy. So when all 10 muscles are working, that patient can bend forward with no problem. Let's say 7 of those 10 muscles are working on the front that make you bend forward. Well, 7 of them are working, then that means that that person can still probably bend forward, but they're probably going to feel a little bit of tightness, because what's going to happen is these muscles in the back are going to start to restrict how far forward you can go, because they're acting as a protective mechanism so that you don't go too far, which damages the vertebrae that's in between these back muscles and these front muscles. Now, let's say a patient comes in and they're in excruciating pain, and I find only 3 of these muscles on the front are working. Now I know that if only 3 of these muscles are working, then your body, your brain is automatically saying, hey, you know what, let's not bend forward, because if we bend forward, there's a high probability that we're going to damage something here, because even if these guys get tight, they may not be able to support the weight or keep the weight from moving forward so much that there's damage here. So in that instance, what muscle activation can do, muscle activation, the difference is it allows me to go in and check each of the 10 muscles and find the 7 that aren't functioning properly, get them working where you're able to bend forward with no problem once we get 10 of them working. But understand that I may only need to get 7 working or 8 working in order for your pain to go away. You may still have some tightness, but your pain will be alleviated significantly when you go from only 3 muscles working to now 7 or 8 muscles working. And then it's just a matter of getting those other muscles working, other 2 muscles working, so we're at full strength at 10, and now you're completely pain-free and symptom-free, and we solve the real problem. That's a quick example of how muscle activation works and gets you better.